I'm board-certified New York City plastic surgeon Dr. Darren Smith, and this is Plastic Surgery Before and After, your source for the real deal about plastic surgery procedures, news about trends in aesthetic medicine, and candid sessions with industry insiders. We hope you enjoy today's episode. What can I do about my abdomen post-pregnancy if I don't want to have a tummy tuck? Well, I'd like to introduce a new concept in abdominal rejuvenation or abdominal contouring that we've been working with in our New York City plastic surgery practice and having great success. So, the abdominoplasty has always been the mainstay of abdominal rejuvenation, and this is because it really addresses all of the different anatomical problems that occur in the abdomen after pregnancy that it is possible to address with a surgical approach. And we speak about these issues according to the anatomical layer that they concern. So, working from the outside in, after pregnancy, the skin envelope of the abdomen is stretched by the expanding uterus, and after the baby is delivered, often the abdomen can't contract back, the skin can't contract back to its original tight level, so we're left with loose, ripply skin after pregnancy. Moving down a level, there's often some fat redistribution after pregnancy and breastfeeding, so there's excess abdominal adiposity that can be very stubborn and very difficult to lose after pregnancy and breastfeeding. And then finally, when we look at the abdominal wall itself, that combination of muscle and connective tissue, specifically the rectus abdominis muscles, those are the vertical six-pack muscles, those often spread apart during pregnancy to make room for the expanding uterus, and when they cannot completely come back together after pregnancy, we're left with a very common condition called a rectus diastasis, and that's when there is space that remains between the rectus muscles after pregnancy. So an abdominoplasty and the liposuction that it's often combined with addresses each of these layers very effectively. We can directly excise skin excess with an abdominoplasty. We can get rid of excess abdominal fat with liposuction, and there's also some direct excision as part of an abdominoplasty. And finally, the rectus diastasis, or the separation of the rectus muscles in the midline of the abdomen, is dealt with by plicating the rectus abdominis muscles. That is, we sew them back together in the midline to reconstruct the abdominal core. And there's a reason that the abdominoplasty is the mainstay of abdominal rejuvenation and often the centerpiece of a mommy makeover. It works well. However, an abdominoplasty can be a major investment both in time and in recovery, and it's just not something that's compatible with everyone's life. And for folks that don't have, very severe skin laxity or a major rectus diastasis or significant fatty deposition in the abdominal region after pregnancy and breastfeeding, it would be great if there was another approach to start to move in the same direction as the kind of results that we see after abdominoplasty, even if the end result isn't quite as dramatic. So for these people that have mild to moderate skin laxity of their abdomen, a mild to moderate rectus diastasis, and just a small amount of fat redistribution to the abdomen, there is a great combination of procedures that we've been using with which we've been seeing some really nice success. And we've covered each of these things individually in earlier episodes if you'd like to hear about them in more detail. But here I'd like to really talk about how they work together nicely to deliver an excellent result for mild to moderate cases of abdominal contour issues after pregnancy. And these three technologies are BodyTite, which is radiofrequency skin tightening, liposuction, which we've covered at length elsewhere, which is where we remove fatty deposits through tiny incisions in the selected treatment area, and finally Emsculpt, which is a non-invasive treatment that uses high-fem or high-intensity focused electromagnetic energy to provide an intense muscular workout. And by using these three technologies together, we can provide a nice change in abdominal contour and abdominal rehab for women that have given pregnancy and have mild to moderate abdominal contour issues. So by using this combination of treatments, while we cannot achieve a result that's quite as profound as what we can get with a true abdominoplasty, we can get a nice improvement in the properly selected patient for a lot less money and a lot less downtime than you would have with a traditional abdominoplasty procedure. So just to move through these treatments one by one, for mild to moderate skin laxity, we have been using the body tight treatment, which is radiofrequency skin tightening. This is a device that has two poles. One pole is at the end of a very thin wand. The other pole is at the end of a thicker piece of the device, and the thinner pole goes under the skin through a very small 3 to 4 millimeter incision. The other pole travels along the surface of the skin following the internal pole, and radiofrequency energy is passed between these two poles. That's why it's called bipolar or two-pole radiofrequency skin tightening, and it heats the skin. It causes a controlled thermal injury, and then as that controlled thermal injury heals by contraction, the tissue tightens. So whereas with an abdominoplasty, we are directly excising skin by making a big excision, with radiofrequency skin tightening and body tight, we can provide some real degree of skin tightening with a truly minimally invasive procedure. At the same time, I mentioned that with a tummy tuck, we're often performing some liposuction to address fatty excess after pregnancy. Addressed two layers, the two outermost layers of the abdomen, with these minimally invasive procedures, the body type for the skin and the liposuction for fatty excess, that with an abdominoplasty we would have addressed with a true excisional procedure requiring a long incision. For the deepest layer of the abdomen and to address the changes that it's undergone after pregnancy, in a tummy tuck, we are going to sew those rectus muscles back together in the midline. We're going to perform a plication of the rectus muscles to treat a rectus diastasis. But now, with the advent of M-Sculpt, we can actually address a rectus diastasis non-invasively. By using HIFEM, or highly focused electromagnetic energy, we're able to perform the equivalent of 20,000 crunches in 30 minutes. And by achieving these supramaximal muscle contractions, it's been shown that M-Sculpt can actually cause an 11% on average improvement in diastasis recti. Now again, 11% is not earth-shattering, but for someone with a mild to moderate problem, combining M-Sculpt with some liposuction and the body type procedure, we can really achieve some very nice results with a procedure that has minimal downtime and really can be performed at a fraction of the cost of a traditional abdominoplasty. So by no means are we advocating that we can replace or reproduce the dramatic changes of an abdominoplasty with this combination of M-Sculpt, liposuction, and body tight. However, what we are saying is that for folks with a mild to moderate problem that don't want to have the downtime or expense associated with a classic abdominoplasty, this combined minimally and non-invasive approach may be a reasonable option to consider. Thanks for listening, and don't forget to subscribe, share the show, and head over to DarrenSmithMD.com for more real-world plastic surgery talk.